Namaskar, good morning, welcome. Excellency, Honorable Minister for Health and Family Welfare, Chemicals and Fertilizers, Government of India, Dr. Mansukh Mandaviya ji. Excellency, Dr. Tedros, DG of WHO. Excellency, Mr. Katsunobu Kato, Honorable Health Minister, Japan. Excellencies, Honorable Ministers of State for the Ministry of Health and Family Welfare, Professor S.P. Singh Baghel and Dr. Bharti Praveen Pawarji. Our Additional Secretary and Sue Sherpa from India, Shri Abhay Thakurji. Colleague in the Ministry of Health, Shri Love Agarwal ji. Honorable Ministers of the Troika from Indonesia and Brazil. Honorable Ministers of the G20 countries, the deputies and ministers from the invited countries, distinguished delegates, officials from all ministries, colleagues, ladies and gentlemen. At the outset, I would like to welcome all of you for this ministerial meeting in Gandhinagar, Gujarat, during India's G20 presidency. Over the past 3 years, the world has witnessed the devastating impact of the COVID-19 pandemic, which has affected hundreds of millions around the world. While the pandemic has officially been declared to be over, the COVID-19 fatigue should not be the reason leading to the cycle of neglect. We must improve our ability to prevent, prepare, and respond to health emergencies and strengthen international cooperation for a coordinated strategy to ensure the safety and well-being of all our citizens. It is also crucial to ensure equitable access to safe, quality, effective, and affordable medical countermeasures for everyone. We must address the disparities in health access and create an environment where medical countermeasures are available and affordable to all nations regardless of their economic capacities. In this era of technological advancement, digital innovations and solutions have revolutionized the healthcare delivery and improved the patient outcomes. We can enhance service delivery, the quality and efficiency by harnessing the power of data, artificial intelligence, and machine learning, and through solutions like telemedicine. These three health priorities are inherently interlinked and mutually reinforcing. In addition to these three priorities, India has hosted 13 co-branded events that discussed various health challenges in the run-up to this ministerial meeting during the year of the presidency of the G20. Excellencies, on the sidelines of the Health Ministers meeting, we are also hosting the WHO Traditional Medicine Global Summit, the One Earth, One Health Advantage Healthcare India Summit, and the Sustain, Accelerate, and Innovate to End TB in the Southeast Asia region, a WHO Southeast Asia Region TB event, along with the Indian MedTech Expo as co-branded events which were inaugurated yesterday. Furthermore, we have curated exhibitions spread over 100,000 square feet, covering the health sector, including medical technologies and devices. We look forward to the guided tours to these exhibitions by the excellencies who are visiting from all the countries. Together, we need to converge, consolidate, and create a healthier tomorrow. Thank you. Jai Hind.
Thank you, sir, for your welcome remarks. Excellencies and distinguished delegates, today we are also joined by His Excellency Mr. Kasnu Nobu Kato, Honorable Health Minister, and also G7 Presidency for the inaugural session. I would like to request Excellency, Honorable Health Minister Japan and G7 Presidency for delivering the keynote address. Excellency, you may have the floor, please.
Thank you, Indian Princess and Minister Mandaviya. I would like to pay my respect for all your effort and great leadership in facilitating the important agenda in global health. I also would like to express my sincere appreciation for all the endeavor and warm hospitality of the Government of India, Gujarat State, and the Gandhinagar District upon holding this meeting. Despite the busy schedule, thank you, Minister Mandaviya, for joining the G7 Health Ministers meeting in Nagasaki in May and the Japanese presidency. I'm grateful to be invited to your hometown, Gujarat, for the G20 Health Ministers meeting and looking forward to discussing with G20 colleagues. Furthermore, I'm very honored to have the opportunity for an intervention at the inaugural session. I'd like to share a few points from the perspectives of synergy in G20 and G7. 3 years have passed since the outbreak of the COVID-19, and there has been a growing interest in the health sector. During this period, there were progresses in international cooperation, including the sharing of information in a timely manner, supporting the medical and health systems, and developing the medical countermeasures. It's needed to build resilient health systems from peacetime, as well as contributing to the pandemics based on the lesson from the COVID-19 pandemic. Based on this situation, we have set 3 main agendas under the theme as working together for a healthier future. The 3 agendas are strengthening global health architecture for public health emergencies, contributing to achieving more resilient, equitable, and sustainable universal health coverage, and promoting the health innovation. And we discussed this with G7 members and outreach countries, India, Indonesia, and Vietnam. This year's G20 agenda has strongly synergies with the ones in the G7, and we see this as an opportunity to further develop the discussions at the G7. In addition, this year marks a milestone that UN General Assembly high-level meeting on pandemic PPR, UHC, and TB will be held next month, while discussion on amendments to the International Health Regulation and WHO take place in the WHO. It's important to enhance the political momentum through G20 and G7 and move toward leader-level discussions. Now, I would like to share the outcome of the G7. First, regarding UHC, Japan achieved UHC early by establishing a universal health insurance system in 1961. We have been leading the discussions and cooperating globally based on our experience. At the G7 this year, we talked about action that should be taken as the G7 toward achievement of UHC across the world, while recovering from various health issues set back by the pandemic. These actions were arranged under action areas and compiled as Global Plan for UHC Action Agenda as an annex to the Health Minister's Communique along with the UHC Action Agenda by UHC 2030. Furthermore, it was emphasized to note the importance of global hub function, including the financing, knowledge management, and human resources on UHC, not only during the pandemic, but also at peacetime. Second, on MCMs, at the G7 summit, the G7 Hiroshima vision for equitable access to the medical countermeasures was released, and based on the principles in the vision, MCM Delivery Partnership for Equitable Access, MCDP, was launched as one of the concrete efforts to promote equitable access and delivery of MCMs. Third, on AMR, for the first time in the G7, the importance of implementing pull incentives were recognized, as well as push incentives to facilitate research and development of new antimicrobials. In Japan, we are starting a new project on pull incentive this year, in addition to continuing the push incentive effort. We are also planning to hold the G7 high-level technical meeting on One Health in the later half of this year, with participation from ministers of health, agriculture, and environment. Next, regarding collaboration between finance and health ministers, G20 Joint Finance and Health Minister meeting was first held in 2019 under the Japanese presidency. In light of importance of financing is promoting UHC. We held the G7 Joint Finance and Health Ministers meeting, and we emphasized further strengthening finance-health coordination and the necessity to consider the pandemic response financing, including surge financing. Lastly, in order for working together for a healthier future for people across the world, it's important to enhance collaboration among the G20 members and effort in each G20 and G7. I hope the next year's presidencies, Brazil in G20 and Italy in G7, would build up the outcomes of this year to the next year and beyond. Japan will continue to contribute, work together. Thank you very much.
Thank you, His Excellency. Thanks for highlighting the ongoing convergence between G7 and G20 platforms and acknowledging the deliberation of health priorities in India's G20 presidency. Colleagues, we're also joined here by His Excellency Dr. Tedros, DG WHO. I would now like to request Dr. Tedros to deliver his keynote address. Sir, the floor is yours, please.
Thank you, our moderator, Love Agarwal. Thank you so much for your leadership and hard work during all this process. Your Excellency, Minister Shri Mansukh Mandaviya, Your Excellency Minister Kato, Excellencies, colleagues and friends, Namaste. I thank India for its generous hospitality and for its visionary leadership by making health a priority of its G20 presidency. I also congratulate India for its commitment to universal health coverage at home, especially through Ayushman Bharat, the world's largest health insurance scheme. On Wednesday, I had the opportunity to visit a health and wellness center here in Gujarat, which is providing primary care services to 1,000 households. I was especially impressed by the use of telemedicine to provide consultations with prescriptions provided online and medicines distributed locally. This is just one example of how digital technologies are transforming health locally and globally. I thank India and all G20 countries for your leadership in developing the global initiative on digital health, which will launch formally tomorrow. This important initiative will support the WHO Global Strategy on Digital Health and amplify other initiatives, including the WHO Global Digital Health Certification Network, which we re-established earlier this year with the support of the European Commission. And my appreciation, we want to use this opportunity to thank the European Commission. Digital technologies have proven potential for delivering health services to marginalized groups, for improving quality of care, and for detecting, preparing for, preventing, and responding to health emergencies such as COVID-19. Although COVID-19 is no longer a global health emergency, it remains a global health threat. Just yesterday, WHO classified a new variant with a large number of mutations, BA2.86, as a variant under monitoring, highlighting once again the need for all countries to maintain surveillance. This is also why we're continuing the ACT Accelerator and why we continue to seek the support of G20 countries for it. COVID-19 has taught us all an important lesson, that when health is at risk, everything is at risk. There are encouraging signs that the world is learning the painful lessons of the pandemic, beginning with the presidency of Saudi Arabia. A relay of discussions led to the establishment of the Joint Finance Health Task Force under the Italian presidency, supported by Indonesia, and now India under their respective presidencies. As you know, negotiations on a pandemic accord and amendments to the international health regulations are making good progress. Both processes are essential for creating the legal and operational framework for an inclusive, coherent, and equitable global health security architecture. In tandem, WHO is leading or supporting several initiatives to strengthen health emergency preparedness and response, including the Pandemic Fund, the WHO Hub for Pandemic and Epidemic Intelligence, the WHO BioHub System, the Global Health Emergency Corps, and the Universal Health and Preparedness Review. Building on the lessons learned from the success and shortcomings of the ACT Accelerator and other processes, including the G20 and the Johannesburg process, WHO has developed a concept note for an interim mechanism to coordinate timely and equitable access to medical countermeasures for epidemic and pandemic threats. We welcome the constructive discussions that G20 countries have held here in Gandhinagar and thank India for its leadership on this. We encourage you to work with non-G20 countries to build and broaden consensus, and we look forward to establishing the interim mechanism at the earliest opportunity. Let me leave you with 4 requests. First, I seek your commitment for the implementation of the global initiative on digital health. Second, I seek your commitment to inclusive and consultative dialogue with all member states on the interim mechanism for medical countermeasures. Third, I seek your continued support for the Joint Finance Health Task Force to complete its work on surge financing and economic vulnerabilities to pandemics, and to continue the collaboration to address other challenges. And fourth, I seek your commitment to negotiating a comprehensive pandemic accord that encompasses all the lessons of the pandemic so that we never repeat the same mistakes again. time is the essence, and with the accord scheduled to be considered by the World Health Assembly next year. My thanks again to India, to Prime Minister Modi, and also to Minister Mandaviya for their leadership, and to all of you for your leadership for a healthier, safer, fairer world. I thank you. And back to you, Lam.
Thank you, His Excellency Dr. Tedros, for highlighting that time is of essence and the fact that there are certain concrete deliverables which we should focus on in the times to come when it comes to a strengthened health system, and we remain prepared to manage any future health emergencies. Thank you, sir. We take note of your guidance. Dear colleagues, we are joined by Excellency Dr. Mansukh Mandaviya, Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizer, Government of India. It is my distinct privilege and pleasure to request the Honorable Minister to deliver his inaugural address. Sir, the floor is yours, please.
Join us today, Excellency Katsunobu Kato, Honorable Health Minister, Japan's G7 Presidency, Dr. Tedros, Director General, World Health Organization, Sri S.P. Singh Baghel, and Dr. Bharti Praveen Pawar, my colleague Union Minister of State, Health and Family Welfare, Sri Abhay Thakur, India G20 Presidency, South Sherpa, Sri Love Agrawal, G20 Health Focal Point, Honorable Ministers of Troika from Indonesia and Brazil, Honorable Minister of G20 and invited countries, distinguished delegates. Namaste. It is my utmost honor to warmly welcome you all to my home state of Gujarat. The city of Gandhinagar commemorates the lasting memory of Father of Nation Mahatma Gandhi and the value of ahimsa, means non-violence, satya, truth, and sarvodaya, universal upliftment. His teaching of voluntary cooperation, dignified and peaceful coexistence has not only inspired our Indian Constitution but also driven our endeavors in G20 to collectively build one earth, one family, and one future. Excellencies, having witnessed one in a century crisis of COVID-19, we are G20 have a duty to prevent, prepare, and respond effectively to any such future crisis. Towards this, India prioritized health emergency prevention, preparedness, and response, placing emphasis on the One Health approach, recognizing that the well-being of our communities depends on the harmonious balance in the ecosystem. We have collectively agreed on a need for an end-to-end medical countermeasures coordination mechanism to timely deliver safe, quality, affordable, and effective vaccines, therapeutics, and diagnostic. Excellencies, equitable access to vaccine, therapeutics, and diagnostic should be a non-negotiable right of every individual. Joint vision of G7 and G20 on medical countermeasures is a remarkable convergence, and we as G20 continue to align with WHO process of working group on international health regulation and intergovernmental negotiating body. It remains my utmost hope that G20 can eventually facilitate the creation of permanent mechanism. Excellency, COVID-19 served as a pivotal catalyst for greater adoption of digital health in empowering patients. The fragmentation and limited intersectoral collaboration limit its potential presently. The Presidency has worked closely with WHO to establish the Global Initiative on Digital Health, WHO Managed Network. I thank all G20 members for their leadership in designing the initiative. I acknowledge the support and contributions of the Asian Development Bank, Vadwani AI, PATH, FIND, SEPI, Gates Foundation, SAFE, Foundation Bostnar, and other to GIDH. I urge all to consider aligning to the vision of GIDH and look forward to your commitment to the agenda. Also, I am delighted to state that our negotiators have completed negotiations on the text on the Health Ministerial Outcome document and have successfully concluded a discussion on all subjects bearing one geopolitical paragraphs on Ukraine. I congratulate our negotiating teams. They have burnt the midnight of 4 weeks and have reached an agreement of critical global health matters after many rounds of in-depth discussion. The text of the final Health Ministerial Outcome document has been shared with all of you today. So, with the concurrence and support of all of you, I now have the pleasure of declaring its finalization and adoption by all of us. It will be released formally to the media tomorrow. I once again thank you for your goodwill and constant support in ensuring that this collective endeavor of ours has been concluded successfully. I look forward to an effective follow-up of our agreed outcome document and its implementation in the months and years ahead. Excellencies, the challenges we face may seem diverse and different, but they stem from similar fault lines. I would like to begin today with a thought by Gandhiji. The future depends on what we do in the present. Let us seize this moment today, unite in purpose, and resolve to create a healthier future for all. Thank you. Thank you very much.
Thank you, sir, for sharing your valuable insights on the issues being deliberated in the Health Working Group. May I now request if we can have the curtain raiser video, please.
India welcomes you to the momentous G20 Health Ministers meeting in Gujarat. A land renowned for its industry, rich culture, and historical significance. Gujarat is the home of Mahatma Gandhi, the father of our nation, an apostle of peace, truth, and non-violence across the world. 8 months ago, the Health Working Group embarked on a landmark journey to deliberate upon a transformative health agenda that will go a long way in building resilient, responsive, and robust global health architecture Prime Minister Shri Narendra Modi envisioned that India's G20 presidency should be inclusive, ambitious, decisive, and action-oriented. And we would like to thank the distinguished delegates for making this possible. So far, India has successfully conducted 3 health working group meetings and side events in Kerala, Goa, and Telangana on the 3 identified health working group priorities and 13 co-branded events on other focus areas such as adolescent health, food safety, non-communicable diseases, tuberculosis, and climate change and health. Now, as we meet today and tomorrow for a historic health ministers meeting, let us recap our priorities and deliverables. In alignment with India's G20 theme of One Earth, One Family, One Future, the working group acknowledges the initiative of Asian Development Bank towards launching of a climate and health initiative to facilitate knowledge sharing and partnerships in these 2 critical intersecting areas. While we finalize the permanent global medical countermeasures mechanism and undertake detailed deliberations in intergovernmental negotiating body, we look forward to the launch of an interim global medical countermeasures coordination mechanism progressively during the G20 ministerial meeting. The Health Working Group recognized the need to create a comprehensive ecosystem that converges efforts and investments in the digital health arena. We conceptualized and designed the global initiative on digital health. Built on 4 pillars, this WHO-managed network will converge digital health initiatives, funds, and create a repository of quality-assured digital health technologies. India acknowledges the efforts of the G20 countries, invited nations, and international organizations in shaping the health priorities and deliverables. We all need to work towards ensuring equitable, accessible, and affordable health services for all, leaving no one behind. Let us converge, consolidate, and collectively create a healthier future. One Earth, One Family, One Future.
Distinguished colleagues, it is my distinct privilege to now request the Honorable Ministers from Troika countries for their opening remarks. I would submit if the opening remarks may please be limited to 5 minutes each. It is my privilege once again to invite Excellency Mr. Budi Sadikin, Honorable Minister for Indonesia, to deliver his opening remarks. Excellency, the floor is yours, please.